Hi everyone, and welcome to today's webinar that we're running today as part of the World Maternal Mental Health Day on the 1st of May 2024. And in today's webinar, we're going to be talking about combating loneliness in motherhood, making connections and accessing support. So my name is Roisin O Donovan, and I am a researcher working at the Centre for Positive Health Sciences in the RCSI. And I've been working in this area for the past year alongside my colleagues that I'm joined here with today. And we've been conducting research around the well-being of women during pregnancy and during the first 2 years postpartum that follows. So I'm going to hand you over to Niamh and Sabrina to introduce themselves before we get started. Niamh.
So my name is Niamh Crudden. I work with the mental health services in Dublin South and Kildare, West Wicklow, and I also chair the Perinatal and Infant Mental Health Working Group that covers Dublin South and Kildare, West Wicklow. So we're a very active group in the community here with lots of organisations, both from within the HSE and from the community, who've come together to try and improve outcomes for women across our region. So very happy to be here today on World Maternal Mental Health Day.
Thank you, Niamh. And Sabrina.
Hi, everybody. My name is Dr. Sabrina Coyle. I'm a senior perinatal psychologist working in the Coombe Hospital. So I'm part of the interagency working group with Niamh, and I've been delighted to be involved with this project with Roisin over the last number of months. And thanks for inviting me to be here on World Maternal Mental Health Day.
Both. So I'm going to start with sharing some background on the research we've been doing and why we think it's so important. And after that, we're going to have a quick discussion between us and launch some resources and a campaign that we've been developing to support women during this time. So just to go into screen here. So just thinking first about well-being during pregnancy and postpartum. So this is the time of significant physical and emotional change for women. And because of that, 1 in 5 will often experience a mental health condition during this time, according to the World Health Organization. And this impacts not only the women who are pregnant or have just had babies, but also the health and well-being of their families and their children. So it's a really important topic that we need to discuss and to tackle. So that was really the goal with the research that we have been conducting. Our goal is to address the gap in wellbeing support for pregnant and postpartum people in Ireland by working together, co-designing an educational programme that is tailored to their needs. So how have we been doing this? Our research started about a year ago, where we conducted a needs assessment across the Dublin South, Kildare and West Wicklow areas. So this needs assessment included a survey and interviews around the topics of health and well-being during pregnancy and postpartum. So we collected 94 surveys. We conducted 3 interviews with women who were pregnant or recently postpartum. And then we also conducted an additional 3 interviews with professionals who are working in the area of perinatal health and well-being in order to capture what they felt were as important to women during this time in terms of supporting their health and their well-being. So to give you a very brief overview of what we found in that needs assessment, first of all, overall, we saw that the women who completed the assessment had suboptimal overall well-being. So their overall well-being was lower than we would ideally like it to be. We asked them specifically about different areas of lifestyle that are relevant to their health and well-being, and we found that the majority were not getting enough sleep, they weren't getting enough exercise, and they were concerned about their eating habits. But the focus of today is more so this significant finding that we found around the number of women who felt lonely regularly. So that was at 77% of the people who completed the survey. And I'll give you a little bit more information on that area of this research now. So first of all, motherhood brings with it many different changes, but a significant change comes to the relationships of a new mother. And that includes relationships with their partner, with their family, with their friends, and also with themselves. So we saw in the interviews and the surveys that women were reporting significant changes across all of these relationships. Some of the changes were really positive. So things like feeling closer with the people around them, with their partners, and having that sense of purpose for themselves, adding a lot to their relationships and to their sense of meaning and purpose as they moved through their lives. But it also came with some challenges, including things like having more arguments with the people around them because they were stressed or because they weren't getting enough sleep. We also saw in both the surveys and the interviews that a lot of women weren't getting as much support as they wanted or needed. A significant factor in this is that a lot of women are now living further from their families, and don't have that support readily available to them in their day-to-day lives as they move through motherhood. So because of this, we found a lot of women were experiencing isolation and loneliness in their day-to-day lives. So the numbers there, again, 77%. So that was women who reported in the survey saying that they felt lonely sometimes, often, or always. So a regular sense of loneliness or isolation. This loneliness increased after they're having their baby, so in the postpartum period. And it was especially significant for women who had just had their first baby. And this loneliness and isolation was impacted by a variety of different factors, but some of which included being on maternity leave, so that change in day-to-day life and maybe not having the connections they were used to through their work. Changes in friendships, so that came with becoming a mother and maybe not having the same connection with friends that they had before motherhood. And then challenges with finding new friends in this new phase of their lives. And then also being far from their family support. So a lot of women not living close to their immediate family and not having that support available to them. So another finding from the research was the need for peer support for women. So that included supporting women in finding and maintaining friendships during motherhood. So maintaining those old friendships and also finding new friendships with women who are at a similar life stage to them, and finding the right support group in their community. So women reported getting a lot of support from breastfeeding and mother and baby groups. But some challenges that came with this was some bottle feeding mothers not feeling they had access to as much support groups as breastfeeding mothers. And then also some financial challenges with being part of these groups. So a key finding really from the research being making sure that these support groups are available to everyone and are welcoming to any mother, and supporting women in finding those groups and accessing the support that are available within the groups. So all of these findings led to the slogan that we have for the campaign we're launching today, the Let's Connect campaign, which is becoming a mother can be lovely, but sometimes lonely. And I'm going to stop sharing my slides here. So Sabrina, I suppose based on both maybe your personal but also your professional experiences working with women during this stage of motherhood, are these findings that I just presented around loneliness, when you first heard them, did they come as a surprise to you, or is it something that you would be aware of in your work?
Yeah, I do. It's not a surprise at all, to be honest, given, my personal experience and my experience working with the women who access the service here. And, I was thinking about it a little bit earlier, and I guess, as you come into the latter weeks of your pregnancy and you get ready to welcome a new baby, there's kind of a normative contracting of your social circles. So, you step out of work, you start to spend more time maybe with your partner, and everything becomes much more focused in on you, your partner, if there's one around, and your baby. And that's part of a normal process, which then continues into the early days and weeks of new motherhood. And, you know, as we all know, those early days and weeks can be really intense and really overwhelming. And I guess the relationships around us, particularly those close, intimate relationships, become even more important. And like you mentioned earlier, Roisin, you know, there can be increased strain on those relationships just due to all of the changes and all of the demands during that time. And so it takes a while, you know, even for the opportunities to reach out again into the world around you. It takes a while for them to open up. And I think, yeah, for women, it can be really hard to make that transition out again and to start making links and forming new relationships and meeting other new mums. And I guess, you know, the other thing that I know from my experience here is that the quality of your social support, so the quality of your friendships and peer relationships during this time, really impacts on your experience. And for women with mental health difficulties, if they have really good social support, it really helps them to improve and progress and start to feel back to themselves again. But for women who are really lonely and isolated, it can make their recovery even more protracted.
Absolutely. And I suppose at a personal level, I could really identify what you were saying, Sabrina, because I'm expecting my first baby in the next 3-4 weeks now. And it is definitely a time where, even though I've had such a privilege of being working with people like you and to be aware from this research of all the supports that are there, but you do start getting, you know, narrowing down, I think, in like that period just before a baby comes, and I'm sure in the period that follows, and the transition really in like then getting yourself to get out there again and opening up to the community, and, you know, making sure that happens at the right time, and having those reminders of the groups that are out there when they're available. But the other question I had was, do you think, like, it sounds like and we can see it in the research as well, a divide nearly between the rural areas and the more urban settings in terms of the types of support that might be available or how accessible they are. Is that something you've seen? Because, you know, the Dublin South and the Kildare areas are probably quite different like that. Is that something that comes up a lot?
Yeah, and maybe I'll pick up on that, Neve, because yeah, I guess, you know, a lot of the new moms that I work with will, you know, be experiencing some kind of mental health difficulty during this time. And yeah, that idea of sometimes the barriers come from within. And I guess, you know, we've talked a lot within the working group over the last couple of years about, you know, normalizing a whole range of experiences for women, and that actually that, you know, idealization of kind of pregnancy and birth and new motherhood, that for a lot of women, it just doesn't happen like that. You know, there's a whole range of experiences that are normative. And I think for women who experience, you know, low mood or anxiety or any difficulties during this time, or even some of the mums whose babies arrive unexpectedly early, maybe they experience a traumatic birth, I think any experience that feels different, you know, is even more isolating, because a lot of the mums I work with will talk about, you know, that experience as feeling really stigmatizing, and it feels even harder to reach out and hold the hope that somebody else will have had a similar experience to you. So I think that idea for me of the barriers within, you know, really makes a lot of sense. So there may be lots of really nice services and supports and resources available, but how do we, yeah, empower new moms regardless of their experience to access them?
That's a really important point in terms of the provision of the variety of services. And also I heard a woman recently describing, you know, making friends as a mom as being similar to dating, and, you know, going on, like, trying out a few new things. Like, if you join one group and it's not for you, that's okay. Go on to another group,
Yeah,
you know, and having
yeah,
that mindset as well as a mom, and like being open to all these different supports when you have them and where you can find them. Yeah.
yeah.
So I suppose my last question before I move on and just show a bit of the Motherhood Programme website is if both of you could maybe say your takeaway point in terms of what you think is the most important aspect of combating and preventing or reducing loneliness and isolation in motherhood. I might go to you first, Sabrina.
Yeah, so I think for me, it brings me back to a really lovely lady that I worked with here who was part of a previous media campaign that we ran called Her Shoes. And as part of her story of experiencing mental health difficulties in the postpartum period, her key message was, don't be afraid to talk, that no matter what you've been through, somebody else has had a similar experience. So just don't be afraid to reach out. So I guess that's my, takeaway message, that, yeah, no matter what you've been through, reach out and, find somebody to talk to.
So I just to follow on from Sabrina's point, I think it's solidarity. So like there's so much solidarity to be found in among mothers, among peers. So I just hope for every woman across our area that she finds her tribe. And I suppose that there'd be more awareness in the community in general of the need to support women during this period. There can be, I suppose, the idea that women, they have their baby and so they're okay, but just that awareness, that connect with mothers, it's really important. We all have a role in making sure women are well and thriving in our communities. And as Sabrina said, just not to be afraid to ask for help, or to ask for help if you need it, but also to ask where your supports and services are and how you can link in. And from our point of view as a working group, that we are ensuring that there are appropriate supports that are available at the right time in the right place for women across the region.
Perfect. And on that, it's probably a good time to share the website, because you can find a lot of those supports on the Motherhood website. So I'll just share my screen here again. And so today, the 1st of May, as part of the World Maternal Mental Health Day, is the day we're launching the Motherhood Programme, which is focused on empowering parents and enhancing well-being. And you can find the Motherhood Programme online. It's at www.themotherhoodprogramme.ie. And I'm just bringing this page up here just to show some of the supports that are specific around loneliness and isolation that might help with that topic. There are other topics covered as well, and I encourage you to go online and browse through it, see if there's anything else that might be relevant to you. But in terms of loneliness and isolation, we have a whole section here on navigating relationships. And in this page, you can find educational videos around relationships. So things like communication within relationships, how you can plan to be able to connect with friends and build new friends, and some really practical resources and exercises that you might find helpful in negotiating the changes that happen in your relationships as you move through motherhood. There's also a podcast episode there on relationships, and we have another podcast episode that you can find in the second page, which is connecting with community. And that's around loneliness, and also how people can kind of reach out and connect with people in their community. So on this page, we also have some of the summary of the research in a bit more detail. So what I showed you earlier, but a bit more detail on that. We have those there in a video format, and then some questions and kind of practical exercises to help you start to think of, what is the group that I'd like to join? What ways can I access this? Where can I go to ask for the help? Who's out there? And you can also find those kind of resources and external supports in the services and supports section of the website. So I encourage everyone to go onto this website today and have a look. There's lots more covered that we're not going to talk through today. So the next piece is the other aspect of what we're launching today is the Let's Connect campaign. And Niamh, I might hand over to you to just give us a little bit of information and background on what's going on with that today.
Thanks, Roisin. Yeah, so the Let's Connect campaign is being launched across Dublin South, Kildare and West Wicklow today. And I suppose the campaign was designed in response to the outcomes of the research that Roisin conducted in collaboration with us across the region, where 77% of women said that they experience loneliness sometimes, often, or a lot. Our tagline is "Becoming a mother can be lovely, but sometimes lonely." And we're making a call to action across the community to combat loneliness in our communities. Let's make connections with new mothers. So we're asking communities to link in with mothers, but also new mothers to think about how they can link with other new mothers, with their peers. So there's a number of elements to the campaign. So we have a social media campaign that will be running across the week of World Maternal Mental Health Day, but with the focus on the 1st of May. So we have a number of social media posts that hopefully you will see flying around on Instagram, X and Facebook. So if you do see them, please share them, or you can get in touch if you'd like the folder of social media posts. We'll happily provide them. In addition to that, we've got posters will be going up all across the region in all our health services and our community partners. We also will be handing out through different organisations that work directly with women, so through the CUM, through the public health nurse services, and through community organisations that work with women. We'll be handing out these ribbon cards. So each card, we have a nice little message to women on the card, just to say to anyone who's reading this, you're doing a great job. And we've 2 ribbons attached to each card. So we're asking mothers who might feel comfortable, if you're interested in connecting with other women, tie the ribbon to your buggy or to your change bag, just to signify that you're interested in connecting. And there's a second ribbon there that you can hand to another mother, whether it's a stranger you meet on the street or someone from a mother and baby group. But in the handing of the ribbon, we're hoping that that provides an opportunity for connection between 2 mothers. So that's a part of the campaign as well. And we also have a postcard where they'll be handed out as well. We're encouraging people to take a picture of the front and to post it to social media. So yeah, if you see the campaign at all, please just share or give us a like. Yeah, we're looking forward to hearing back from communities about the connections that were made with mothers. So
thank you to everyone for joining us today for World Maternal Mental Health Day, and I encourage everyone to visit the website, get involved with the campaign, be it online or in your communities. And thank you so much to Niamh and Sabrina for joining me today. I really appreciate it.
thank you, Roisin.
Thanks, Roisin.